My name's Louise Evans and I am a nurse at Demelza, and I've worked here for 1 year and 3 months. I previously worked at, on an NHS ward for acute children's care. Coming to Demelza was very different. You have to feel confident in your own clinical judgment. You see lots of things that you wouldn't necessarily see on the ward. So we didn't necessarily see a lot of children with tracheostomy. We didn't often see children with gastrostomies, and that's because generally those sorts of cares are done by the families and not the nurses. When you're on a ward, it's very busy, it's very frantic. You generally have more than one patient, so you can have, on my particular ward, you could have up to 6 patients. So you were never able to provide a whole holistic care for that child. So you would do your nursing duties, you would do their medication, you would provide medical care, but that was it. I wanted to come to Demelza so that I could deliver more than that, so I could concentrate on one family and their needs and what they needed rather than just their medical needs. So being a nurse at Demelza means that you have to be confident in your own clinical judgment. We are not like a ward, we don't have a doctor on site. So we have to make those clinical judgments, whether we think that that child needs further treatment, whether we think that that child is deteriorating. That can be quite difficult with our children because they have complex needs. They don't always fit into the normal ranges. So you have to be confident in your clinical judgment and then decide whether or not you need to consult a doctor or the palliative care team. I love my job. I really love my job. And one of the reasons I love my job is because I'm able to give a family my full attention. I am able to care for them. I'm able to deliver all of their clinical needs, but I'm also able to offer them their emotional needs as well. So whether a family requires me just to listen to them just because they just need someone to rant at. The benefits that we have at Demelza, if you have an NHS pension, you can bring that with you and you can keep it. There is gastrostomy training, so because there is gastrostomies, there's jejunostomies, there is nasogastric, there's blended diet, which is quite new to Demelza, but we are given training around all of those. I've seen lots of things here, lots of specialisms that I wouldn't necessarily have seen, and I'm challenged every single day. Join Team Demelza, you won't regret it, I promise.